And a lot of these things, you can see that these lesions are in a lot of the places that we already talked about in their signs and symptoms, like the optic nerve, the spinal cord. We already talked about how that blood-brain barrier also covers the spinal cord, and that's what's being infiltrated. So you have a little chart here to remember that. And now dissemination in time. So this refers to the lesions as the disease process goes on. So the first one that we look for are a new lesion when compared to a previous scan, irrespective of timing. And then the second thing we would look for is the presence of an enhancing lesion, one that we've already seen getting worse. So that new lesion or that worsening. Lesion. And then there's some ancillary testing that we can do. We can do a cerebrospinal fluid analysis, and it would be positive for MS if we saw oligochondral bands of IgG elevated, or also elevated IgG index. So we can put that here. CSF with and the other ancillary testing that we could do would be a test called evoked potentials, and this is going to show a decrease in nerve impulse conduction. Okay, awesome. So the last area that we have not talked about yet is the treatment for MS. And we have three main goals of treatment. Okay, so the first one is to prevent exacerbations. We want to minimize lesion progression, and we want to control their symptoms. So So the main way that we're going to go about doing this is by using disease-modifying drugs. So pretty sure that's right. Maybe not. Either way, the three main drugs that we're going to use are corticosteroids to decrease inflammation. We're going to use immunosuppressants and immune system modulators, and we are going to be using those to reduce the number of relapse, promote remyelination, and prevent further demyelination. So we have our corticosteroids. Immunosuppressants. And immune system modulators. And these two can come either PO, oral, or IM. And this is also in the works. Research-wise, they are investigating the use of vitamin D supplementation as well as stem cell therapy. So we can put that, I guess, as a little fourth one. And this ties back to our risk factors of a low vitamin D level. A little messy. Okay. And then some important considerations to note. As the provider, we should be thinking if our patient is on corticosteroids, we should be monitoring them for infection. We can also help them out with some symptom management. This usually consists of rehab, PT, and OT to prevent immobility complications such as pressure sores, respiratory and urinary infections. And then we also, if they are smokers, back to here, our risk factors, we would want to do some smoking cessation education with them, avoid any overwork, avoiding extreme fatigue, and also avoiding heat exposure, which comes back to our Euthophs phenomenon. So we have I want to do, what do we have? PT, OT. And back to this as well with the whole pressure ulcers, that also ties back into monitoring for infection. That can, if they end up with pressure ulcers, that can also lead to infection. We have the smoking cessation. All right. So as you can see, everything kind of ends up tying back in with itself. The patho relates to the risk factors, the treatment relates to the history and exam findings. Testing is kind of also tied in with our history and our symptoms of physical exam findings. And yeah, so all in all, we kind of have a little chart to follow if we end up seeing multiple sclerosis in practice. So I hope that all made sense to you guys, and I look forward to learning from your videos as well. Thanks.